Well, good afternoon, everyone. My name is Linda Ward. I'm the President and CEO of Gulfside Healthcare Services, and I would like to welcome you to our webinar today, The Comfort of Home with Specialized Acute Care and the Benefits of Hospice Care Center. We are so happy that you were able to take time out of your busy day today to join us, and we are really glad that you're with us as healthcare providers in the community in serving patients in need. Our speakers today will provide you with valuable information as healthcare partners in providing specialty care at the acute level of care for hospice care. And this is for you as our healthcare partners so that you can get some firsthand knowledge from our experts at Gulfside about the specialized care for your patients when the time is right. Today, we have Dr. Lisa Barker, our Chief Medical Officer. We have Jennifer Williams, our Director of Patient Care Services. Bryant Shurley is with us, our Assistant Director of Nursing and Nurse Practitioner, and Kourtney Gabardi, our Manager of Patient Navigation. And each of them will be presenting special areas of interest when it comes to the care center in preparation for its opening late fall, early 25. We'll also be able to take all your questions, so please make sure that during the webinar today, if you do have questions, to go ahead and enter them in the Q&A tab, and at the end of the webinar, we will be answering all of your questions. So again, thank you so much for joining us. At this time, I would like to introduce you to Dr. Lisa Barker, our Chief Medical Officer. Dr. Barker is a graduate of the University of Kentucky College of Medicine and is board certified in hospice and palliative medicine. After discovering her passion in end-of-life care, she became a certified hospice medical director. She moved to Florida in 2016 to join Gulfside Healthcare Services and became Chief Medical Officer in 2024. A fellow of the American Academy of Hospice and Palliative Medicine and a certified physician executive, Dr. Barker also serves as faculty for medical training programs focusing on improving hospice and palliative care delivery. So I'm very proud to introduce Dr. Barker, who is going to be talking about hospice eligibility for our care center. Dr. Barker?
Thank you, Linda, for that introduction. I'm going to be speaking to you about patient selection and eligibility for the hospice care centers. So patients are eligible for inpatient services at a hospice care center under certain circumstances. When symptoms such as pain, nausea, or restlessness are present that cannot be managed at home or in another setting, the care center is the most appropriate place for the patient to be. Once there, they can receive advanced care by hospice specialty trained providers who are experts in providing comfort to meet the patient's needs. When patients are moving from the hospital, especially from the intensive care unit, and entering into hospice care, the care center can also be used to assist in that transition. In the setting of the care center, the patient can also receive skilled care, such as intravenous medications or advanced respiratory support, and at the same time receive caregiver training and education while preparing to return them to their home environment. For them, home could be either a private home, it could be an assisted living facility, or it could even be long-term care. The care centers are also used for more aggressive titration of medications in a setting where the patient can be closely monitored and where any side effects can be managed. And again, this is for intensive symptom management. This can also be required for hospice patients as they approach the end of life. And if those needs cannot be met elsewhere, the care center provides both a beautiful and peaceful setting with support and care for both the patient and their family during this difficult time. Our facilities offer short-term ventilator support for terminally ill patients. This is through what is called our Gift of Time program, and this allows the family to gather prior to removing the artificial support. Bryant Shurley will be providing you with more detailed information about this program shortly. Overall, try to think about our hospice care centers as a hospice hospital, where a higher level of specialty care can be provided to meet the needs of both the patient and their family.
Thank you, Dr. Barker. All right, and next we have Jennifer Williams, who is our Director of Patient Care Services. And Jennifer is a nurse practitioner herself. She's the director of our patient care services at Gulfside Hospice. She holds nursing degrees from Lorain County Community College, Aspen University, and South University. With over 25 years of experience in various healthcare settings, Jennifer is passionate about empowering nurses and advancing hospice care. Jennifer frequently speaks at hospitals and nursing schools about hospice care, and she sits on the nursing advisory board at St. Leo University, St. Leo University and Kaiser University. She oversees Gulfside's inpatient hospice units and has implemented initiatives like compassionate ventilator withdrawal to improve patient care. Her dedication to nursing has had a positive impact on Gulfside Healthcare Services patients. So at this point, I'm very proud to introduce Jennifer, who's going to be talking about steps to transferring patients.
Thank you. So once a patient has been identified as being a candidate or potential candidate for inpatient care, a specially trained hospice nurse is sent to evaluate the patient. The nurse works closely with the patient and their family to ensure that they are in agreement with hospice care and inpatient care. The nurse collaborates with the hospice physician or nurse practitioner to determine eligibility for inpatient care, whether that's for symptom management, non-invasive oxygen weaning, or our compassionate ventilator withdrawal program. Orders are then obtained for transfer to our care center. The hospice nurse also collaborates with the sending facility to obtain medical records, including DNRs, power of attorney, healthcare surrogate documents, the current medication list for the patient, as well as the discharge summary. So all of this can be sent with the patient. The hospice team then sets up transportation to our care center. The hospice nurse remains in close communication with the patient, the primary caregiver, the facility, and the patient's primary care provider regarding the patient's inpatient stay, including expectations for the length of that stay, symptoms that we plan to manage, and the discharge planning. Discharge planning from our care center starts prior to arrival. We always have the goal to stabilize the patient's symptoms as quickly as possible and have the patient return home to wherever it is that they call home as soon as possible.
Thank you very much, Jennifer. All right, next, I'm very happy to introduce you to Bryant Shurley. Bryant Shurley is a nurse practitioner and is a primary care nurse practitioner certified in adult gerontology and hospice services. Bryant is the Assistant Director of Clinical Inpatient Services for Gulfside Hospice. He has 14 years of experience in the nursing field and has practiced in multiple capacities, including the intensive care unit, hospice house, nursing supervisor, for the nurse practitioner. He currently provides leadership to clinical staff in Gulfside's 2 inpatient care centers and is one of the primary providers for inpatient care. Bryant has assisted with bringing the compassionate extubation programs to our inpatient care centers, allowing families to spend more meaningful time with their loved ones at the end of life. And at this point, again, I'm happy to introduce Bryant, who will be speaking about our specialty programs at Gulfside.
Thank you, Linda. With our Gift of Time program, Gulfside Hospice is able to use our care centers to allow families more moments with their loved ones at end of life. If a patient is intubated on a ventilator with support, but they have no meaningful hope of recovery, families and providers might opt for a compassionate extubation so as to not prolong the patient's suffering. When families come to our 14-bed standalone inpatient care center for a compassionate extubation, there's ample space in our large private rooms for multiple family members to gather if they desire. Free from the busy and loud hallways of an ICU, we bring intentionality to providing a peaceful environment. We have 24/7 visitation, so however long the patient has, family can be there right beside them. Our providers are at the bedside before, during, and after the extubation to make sure patients are as comfortable as possible. We have skilled RNs and respiratory therapists who are experienced in providing this very specialized care and service. And afterwards, patients are in a comfortable place where they can die with dignity. Families don't have to worry about transporting their loved ones once again post-extubation. So currently at our East Side Inpatient Care Center, we're able to not only provide those compassionate extubations in a peaceful environment, but we can also hold a patient on a ventilator for several days if needed. Families might understand that their loved one is dying and believe that extubation is the right path forward for them, but they might not be ready at that exact moment. Some family members might be out of town, out of state, out of country, and they just need time to gather everyone for the family support. And some families might just need an extra day to grieve. So instead of taking up an ICU bed for this ultimately expected extubation, we can bring them into our care center, provide them with the time and environment these families need. We always have a ventilator on standby for when a patient might need to be held on ventilator support. So as soon as we are using that ventilator, our supplier Integra brings us another one immediately so that there is always one available. We can continue sedation or vasopressors if needed, but there's always the intention that there's no further heroic measures to be taken. We also carry a heated high flow oxygen delivery system for those patients who are unable to be weaned from heated high flow in the ICU as well. So instead of turning off the high flow in the hospital and transporting them when they will probably be in respiratory distress, let us transfer them to our heated high flow and slowly wean them down compassionately as we get patients used to these hospice comfort medications and interventions. These patients might still be awake and alert, but are at end-stage respiratory disease patterns. They can learn to be less reliant on oxygenation as they get used to the hospice comfort measures. And we have the same system with Integra as we do with the ventilators. When one of our machines are in use, we're always sent another clean one ready to be used for the next patient. I've had the honor to be a part of providing these services for several years now, and almost every time families are just so excited to express their gratitude and amazement at how precious these end-of-life moments can be. This gift of time we provide to families is irreplaceable and can absolutely be a beautiful experience. Thank you.
Thank you, Bryant. And now I'd like to introduce Kourtney Gabardi, our Manager of Patient Navigation. Kourtney has been with Gulfside Healthcare Services for 7 years. And again, she serves as our Manager of Patient Navigation. Her role at Gulfside Healthcare Services includes approval of patients for admittance into our inpatient care centers, as well as patient discharge planning. Kourtney has a Bachelor of Science degree from the University of South Florida in social work. And again, I'm proud and honored to introduce you to Kourtney, who's going to talk about discharge planning for our care center.
Thank you, Linda. Good afternoon, everyone. So discharge planning begins at the time of the referral. We have RN liaisons working with the patients and families discussing the criteria for remaining inpatient at a care center. If it is determined that a patient will need placement after the time when they become routine, the RN will reach out to patient and navigation specialists to assist. Patient navigation specialists will begin the process of determining the appropriate placement for the patient. Once patient is transferred to the care center, a patient navigation specialist will continue working with the family on discharge planning. An assessment is then completed to determine the most appropriate placement for patient. This assessment considers the location of the family members. We always want to keep them close as we can to them, the patient finances, and what activities of daily living the patient can complete. The patient navigation specialist then works to find an available bed in the nursing home or ALF. If it is determined that a patient will need Medicaid to assist with placement in a SNF, we submit a Medisys referral to our specialty department to work on that. A member from Medisys will reach out to the family to obtain the necessary documents to complete this application. Patient navigation specialists will also assist in providing resources for private duty companies if family chooses to take the patient home and will need extra assistance. Hospice will order medical equipment and medications necessary and have it delivered to the location where patient will be going. Patient navigation specialist communicates with the family throughout the entire process and ensures that they are in agreement and comfortable with the plan prior to discharge. Once a patient reaches their placement, the continuity of care continues with a seamless report from the care center clinicians to the field team clinicians.
Thank you, Kourtney. All right, so as you've heard today, so much valuable information. You've heard about our care centers, what we provide. Before we get to questions and answers, I'm going to provide some photos of our care centers because not only is the compassionate, skilled care provided, but it's in the comfort of a center and a home-like environment where families can really enjoy. So I'm going to share my screen. Okay, hopefully everybody can see this now. All right, so our new Gulfside Center for Hospice Care is under construction in Newport Richey, Florida. But before we share that information, we want to talk a little bit about our current 14-bed inpatient care center. It's called the Acute Care Center in Zephyr Hills. I believe Bryant talked a little bit about it as well. And this care center became a wonderful resource for Gulfside after we started really serving the whole county of Pasco, and there was a great need on the east side for inpatient level of care. So we purchased 4 acres of land and built this care center with a very Tuscan theme, which worked well for the Zephyr Hills area. This is the lobby into the care center, which is a beautiful piazza. This fountain was donated by a wonderful donor, and we named the Acute Care Center after 2 of our wonderful patients that were generous to Gulfside. In the back of our care center is a path all the way around the circumference of the pond where patients and families can enjoy the beauty of nature. And patient rooms are very large, allowing for as many families to come and stay for as long as they want, and the ability to really just be in a peaceful environment and enjoy the areas of comfort. There's a lot of common areas if families need to just get a little respite from being with their loved ones. And so we're very proud of the care center, which has led us to also have a need in West Pasco. And about a year and a half ago, we purchased another 4.5 acres of land to build our new inpatient care center at 5299 Deer Park Drive in Newport Richey. This is the front of the building. And because it's closer to the Gulf, it's got more of a coastal theme, and we feel that that works well for that side of the county. This is just a quick look at the floor plan. And as you can see, it's quite large. There are 24 individual private rooms. When you enter through the front of the care center, there's a beautiful chapel reflection area here with some quiet care stations for families if they choose to have a meeting with either one of the clinicians or the administrators. In the center here is all patient care area where we've got our nursing stations and our medication room and physicians' offices and social work offices. And then in these areas off to each side are wonderful family areas that consist of kitchenettes and sitting areas and just beautiful surroundings outside of the patient rooms. And inside each patient room, a very large amount of space and sleeping areas for families and a comfortable home-like feeling for our patients. This is the entry into the lobby where there's a large, beautiful water feature before going into the different wings of the center. This is a simulation of one of our patient rooms. So as you can see, it's very home-like, beautiful colors, coastal theme. This is one of the family rooms where it's just close enough to each of the pod areas where there are 4 patient rooms. But again, just to kind of sit and reflect, have a little comfort with other family members if needed. This is a quiet care room where our chaplain or our social worker or our nurse could sit with families to have, just a little get together, maybe a care conference. And this is how our reflection chapel looks. It's non-denominational, but beautiful. There's stained glass that will be on this outside of the building. And the room is, can be used in various ways. This is one of the kitchenettes that's right outside on each side of 12 rooms. So family members and visitors can come and help themselves to refreshments during the day. And we do have family dining rooms. So if birthday celebrations or get-togethers are occurring, we want to be able to provide a beautiful, comfortable space for that. And just like at the Rookie Care Center, we've got beautiful fountains and outside areas. This is going to be a memorial garden for remembering those who have been at our Gulfside Center, and family members can enjoy that right outside. And this is where we are today under construction. As you can see, we've got, roof on, the porte-cochere is being built. This is a back water retention area, but the pond and the memorial garden is going to be over here in this area. And this is just an aerial view to kind of get a feel of where it is. If you're familiar with Little Road, this is Little Road right here. US 54 is up here and Trouble Creek is here. And the Verizon Center is over here. So if you're on Trouble Creek, before you get to Little Road, you would turn on Deer Park Drive. And there's a new Circle K here, and the entrance into our building is right there. So I'll stop sharing. And at this point, open it up for questions. I'm looking at the question and answer box, and I don't see any, but I would just like to open it up and feel free to unmute yourself and ask any questions you may have. All right. At this point, I would like to thank you for joining us today. Dr. Barker or Bryant or Jennifer, Kourtney, Kenan, anyone have any other closing thoughts as we close out our webinar today? All right. Well, I hope you've enjoyed the webinar. A lot of valuable information was shared today. Thank you so much again for taking time out of your day. And we hope to continue meeting with you, and we'll see you soon. Call us if you need anything in the near future.